Hello and welcome everyone. My name is Betsy Minnich, and today we're going to talk a little bit about, or I'm going to talk a little bit about using data and maps for research, curriculum development, and coursework at universities and colleges. I have been with PolicyMap for almost 10 years now and worked primarily with our college, university, and public libraries. And I'm happy to help you explore data and maps for research and coursework at your institution. Hopefully, every data point and map will show you how you can allow students and researchers to better understand neighborhood level data. The applications for PolicyMap are really multidisciplinary and range from public health to environmental studies to urban planning. And we're going to delve into these tools and talk a little bit about how you can empower researchers to uncover insights, create charts and see trends and impact their studies. I will let you know that if you have any questions, that I have a colleague on board who will be answering any questions that you have or letting me know what's there. You can always type questions or put your messages into the chat. And this webinar is being recorded, so if you miss anything or if you'd like to share it with any of your colleagues, it will be available. So what is PolicyMap? PolicyMap, very simply, is an online data and mapping tool that provides about 70 or over 75,000 different data sets from over 150 different sources. And what sets PolicyMap apart is the ability to access research-ready data sets and create maps of up to 5 layers. It empowers our researchers to unravel all this complex data. It eliminates the need for them to go to disparate sources and standardize and clean up that data themselves. And it really makes analysis more intuitive and insightful. You may be wondering who our users are and what programs might find this of interest. First of all, our users really are a diverse audience. It includes, the undergraduate who might be a non-GIS person. They might not be a geography major. It might be someone who's very data literate, and everyone in between. So it's a tool really for novices and experts, and it's a very user-friendly platform, but it's also very sophisticated, and it will allow you to explore and visualize data for a variety of purposes. What I intend to do is maybe give you 2 or 3 different great case studies that we find come up from time to time, and then go online and sort of show you some of the interesting data sets that you might not have been aware of. Some of the applications of data for and maps in academics will indeed be the social sciences, so sociology majors, political science, anyone who's looking at demographic trends, socioeconomic disparities, and community characteristics. It's really data that informs policy. We're also a tool used in public policy and environmental science. Our tool allows the user to identify disadvantaged communities, figure out where communities are burdened by environmental challenges, and the data will help guide policy formulation and ensure and allow them to make decisions about equitable resource allocation. In the field of urban planning, users can evaluate housing data, affordability and cost burden information about digital access, transportation, and lending. In the health science field, our users from nursing to medicine to biostatistics to public health can investigate things like life expectancy, the health and healthcare landscape, data on food and nutrition, education, financial stability, all of those data sets that really are defined as social determinants determinants of health indicators. And then also, and not exclusively, it's a great tool for educational research where your education majors and education policy researchers can explore outcomes, school performance, data on educational equity, and then combine that with other data such as crime data or other social factors influencing policy and intervention strategies. So for my first example, and we'll just talk a little bit about some of the, some nice use cases are, is an example of using PolicyMap or using maps in general to understanding the lasting effects of redlining. So redlining, of course, is a discriminatory practice in which lenders denied mortgage loans or insurance to people in specific geographic areas. And it was often based on race or ethnicity. And these maps can illuminate this concept to students and researchers, and by overlaying historical redline maps with current and demographic and socioeconomic and housing data, they can visually see how areas deemed high risk or undesirable for lending have evolved over time. So you can see how redlined areas might still exhibit characteristics such as lower property values, limited access to credit, and higher rates of poverty and segregation. The maps will allow you to analyze spatial patterns and identify correlations between redlined areas and various socioeconomic indicators. For example, users can examine how redlining contributed to the concentration of poverty, racial segregation and disparities, and access to quality education, healthcare, and public services. And maps also show how redlining facilitated divestment in certain neighborhoods, leading to a lack of specific economic opportunities or declining property values and a deteriorating infrastructure. And finally, the maps can help the researcher to understand how redlining influenced housing market dynamics, including patterns of homeownership, rental housing, and housing affordability. We'll go online and go live in a little bit, but you can also see if you are able to log into PolicyMap or get a trial account from us, how redline areas often face barriers to homeownership with affordability and property investment. And we can also take a look at how redlining areas may experience disproportionate amounts of exposure to environmental hazards, such as toxic waste sites and other issues like that. Another application or common use of PolicyMap in the classroom is working with students to understand the concept of gentrification. And gentrification has varied implications. In long-term residents, especially low-income individuals, may be pushed out of specific neighborhoods due to rising rents. I know that this map is rather small on the slide, but we can see, areas of Philadelphia or a particular zip code in Philadelphia, 19107, with a really high rise over the past 2006 through 2023 in the median value of single-family home sale. This is data that we license from Black Knight, where you can really see the trend and how the neighborhoods have changed within specific areas of a city or a neighborhood. And the character may transform, affecting local businesses and cultural institutions. As these prices rise, it impacts the affordability of housing and everyday expenses. Gentrification can also deepen socioeconomic divides within the communities. So other things that you might note is that new residents may bring different lifestyles or lead to tensions. Oops, I apologize. I'm going too fast. Within a specific neighborhood. You'll also find that while gentrification is often thought of as not a great thing, it can also bring investment and improvements and equitable distribution of benefits into an area. So it's very complex, and it's really interesting for students to be able to take a look at this data. And you'll note that with PolicyMap that you can pull out these trend charts and that you can also publish these trend charts. Okay. I also have another great case study for you about PolicyMap and how we were used at the University of Maryland School of Pharmacy. The University of Maryland wanted to create a comprehensive data warehouse containing community-level demographic and social determinants of health indicators. And this was really challenging for the researchers because it involved time-consuming data collection from various sources. It was frustrating the students and researchers, and their eventual solution was to integrate PolicyMap's community-level data into Maryland's clinical and electronic health records database. And this integration aided in two critical studies at the university. One was the COVID-19 Risk Health Index and substance use and drug overdose prevention. So it was really just a great example about how PolicyMap simplified the collection of that data. It allowed them to integrate our data with theirs and to, do this research. And it made it much more efficient for the researchers and students. And so as we look at PolicyMap data, keep in mind that you can license our data for use by your researchers at your university or organization. Well, when we go online, which I'll do momentarily, we're going to just talk about some of the data highlights. Earlier this year, PolicyMap launched a social determinants of health curated collection, and it conveniently organized all of the data related to that in one place. And it simplified the workflow with all the relevant ready for analysis data and categories that were understandable. Another important area that we'll look at is some of our vacancy data, which we license from Velasas Lists. And it's really an important mapping tool because it reveals data about, housing market health. It shows if there's too much or too little housing. It spotlights gentrification or decline within an area. It informs targeted investment in specific areas, and it shapes housing policies. The vacancy data is also a great indicator of neighborhood stability, and it's also a great place if you're trying to identify areas for commercial or industrial expansion. Another data set that we'll talk a little bit about is a relatively new data set to PolicyMap, and that is the data from the Council on Environmental Quality. It's a data set called the Climate and Economic Justice Screening Tool, and that is used to pinpoint disadvantaged communities facing challenges in 8 key areas. So climate change, energy, health, housing, legacy pollution, transportation, water and wastewater, and workforce development. Some of the other data sets that we'll take a look at are data related to social vulnerability, health professional shortage areas, mortgage loan denials, housing unit affordability, consumer spending habits, and digital equity. So we talked a lot about the social determinants of health data set. I'm going to go online and show you that, but I will show you that it includes data sets related to things like life expectancy, the healthcare landscape, the built environment, social context, nutrition, education, financial stability, and environmental hazards. Okay, so let's jump to the live part of your PolicyMap webinar. And again, if you have any questions, certainly jump in and let us know. When you enter PolicyMap, you'll see that it is a completely clickable, zoomable map, and you can zero in to any area. You can use the location toolbar or put in a specific address. I'll go ahead and jump to Pennsylvania. And one of the most frequent questions that we do get asked is where the data comes from. I already mentioned that the data is coming from about 150 sources, but of course a large portion of that data does come from the US Census, and that's housed under the menu in demographics and other places within our menus across the top of your map. And just for the sake of showing you PolicyMap and how it works, if you're unfamiliar with our tool, you can put data on a map. You can cut out the geographies that you're looking at. If you view the legend, you can go in and look at the different geographies that you can view the data at. So you can go, in some cases, all the way down to the block group level. As I zoom in to a particular area, my geographies will change. And I can take a look at population data in and around the city of Philadelphia and the cities of Philadelphia and Camden. I can also click on Map Extant Data, which will recalibrate the data for just the area that's viewed on your map screen. I can look at things like changes over time or change my geography, even lock in at the geography. So from the variable, I can take a look at population changes over the past 5 years. If I click on any one of these geographies, it will give me the actual fact or the actual value. If I go into a specific county or city level, I can get information in a trend chart that I can pull out. And from this trend chart, I can, take a look at the hierarchical data or the neighborhood level data and pull this out into my reporting. One of the really nice things that you'll notice is that we do have a citation tool. So if I decide that I'm going to print out this map and share it in a report or a presentation, I can create a very high quality image, do some customization here within the map, including scaling and adding data layer descriptions. But I can also, let's go ahead and, sorry, that's not what I wanted. I can cite this. So we do have a citation generator. The newest addition to the citation generator is the RIS file format. Okay, so let's just explore some of the data sets, and let's start with this special curated collection. We did decide to provide this social determinants of health collection to all of our academic subscribers this year so that they could really dig in and benefit from this newly organized set of data. If I simply put on data, we can take a look and see the layers of life expectancy and really understand disparities by taking a look at this. As I mouse over, I can see these areas and neighborhoods in Philadelphia by census tract where the life expectancy is considerably lower than those in areas just a few miles away. So if we're taking a look at Center City, Philadelphia, we have some neighborhoods where, the life expectancy might be 85 or higher. If we head into these areas, in North Philadelphia, you'll notice that it's incredibly lower. And this is really just another of the applications that allows students to immediately understand social determinants of health and how geography does determine, life expectancy and health and success, other issues. So really, really helpful. Also, under social determinants of health, you'll find data related to mortality, drug overdoses, infant mortality. There's also data related to specific chronic conditions. So if I can find data related to diabetes, And another beautiful part about taking a look at this through PolicyMap is that you can layer this data and maybe take a look at 2 conditions or 3 conditions at once. So right now we're looking at the entire range of the percentage of diagnosed diabetes in this area. I can use the slider and put in a specific percentage or cut point, and I can layer that with other chronic conditions or other socioeconomic factors. So maybe I want it to go in and take a look at diabetes paired with something like COPD or heart disease. And from here, I can see where both of those factors are coexisting, or these are comorbidities together. And we can go ahead and take a look at other specific things, like maybe financial stability, household income. And you'll see in many cases this data is disaggregated by race or ethnicity. And I can slide that down to where there might be a larger number of people who are living in poverty, and really find these areas that might be targeted for specific interventions. In addition to this layered data, you can also put on data points. So we can take a look and see, where there might be specific park locations, but in this case, what I wanted to take a look at is, let me go into the health menu. Health locations, I can find where hospitals are or where there are community health centers and lookalikes, and see whether or not there is access to healthcare in these areas. I can filter that data by operating hours or the population served. And from here, I can get some really good detail. Note that when you create a multi-layer map, not only can you, find these areas where everything intersects, but you can use your Boolean logic and or this data together and find where, 2 or 3 or just one of these conditions exists. So we can find areas where there's a larger portion of the population that's living in poverty, but maybe not necessarily with a higher incidence of COPD or diabetes. So there's really just a plethora of data here within the social determinants of health data set. There's going to be data about access to the internet, where I can take a look and see where there are households with access to a computer through smartphone only. And maybe I wanted to see, where the helpers are within the neighborhood. So I can go ahead and look for something like where the libraries are, so that there might be computer terminals or access to lending of Chromebooks or laptops at any of these areas where there might be a larger percentage of people without access to a computer, only through a smartphone. So really, really helpful. We can really delve more into this area and find information about, for instance, limited supermarket access. This is another one of those unique data sets that we were speaking about before, where we can see areas in and around the city of Philadelphia where there's limited supermarket access, also areas of low access, low population. This is data that comes from Reinvestment Fund, which is where PolicyMap was born from. And if you ever have questions about PolicyMap data, we do try to be very transparent about where the data is coming from. You can simply click on the source. It brings you to our data dictionary, and you'll get all of the information about the years available, the geographies available, how far back the data goes, whether or not it's public data, and also whether or not it can be downloaded. So really, really helpful information. Let me see. I need to go back to my sec. And when we're looking at this data on limited supermarket access, it might be helpful to take a look at data related to where the grocery retail locations are, where the farmers markets are, where the SNAP retail locations are. Here, I can go ahead and filter this out and see whether or not there is a full service or not a full service supermarket in these specific areas. If we take a look at this one small area along the Delaware River, we can find out, what's there. And we can also take a look at data about access to transportation from here. So is there a bus route here? And in this case, we're in a large urban area, so yes, of course there is. There's also information about rail lines or stations here. So super helpful, and it allows you to visualize, access to transportation and areas of limited supermarket access. Under social determinants of health, you'll also find data about, healthy assets within the community, data about school enrollment, educational attainment. We can identify areas where there's a large population with less than a 9th grade education. I can, again, change my cut points and do some customization here and, find those areas where there's a much higher population with less than 9th grade education. And we do have a large number of data sets related to education. There's 3 separate data sets that you can take a look at. There's Great Schools data where you can take a look at school performance, and you can filter that data by the rating based on test scores in the state. And, we can really quickly and easily see that these 1s and 2s, the reds, are going to be schools with lower test scores. And we can click through and actually get that data from within each one of these data points. So there's a lot of underlying data here. I can also go in and take a look at data from NCES, or then there's also the Civil Rights Database Collection data. And from here, I can filter this out and see if there's a gifted or talented program or other data related to firearm incidents, student-teacher ratio, student council ratio. And if I color code this, I can figure out whether or not there is a gifted or talented program within these areas. If this is data that I'd want it to pull down for use in other tools, you have a number of different ways to download the data. Our academic users do have access to this premium feature where they can download these data sets from this modal. You can download just the data layer, the data points, or the points with the layer data combined. You can choose the geography that you want. If you're looking for that data by zip code tabulation area, you can pull that out. And then there's 2 different data formats. So there's a human readable format, a CSV file, and then there's a CSV file with the data specs. So if you're going to bring this into Tableau or R or Python, it's relatively easy to download this data for use in other tools. Other data sets that I really wanted to highlight, and I talked about showing you, were some of our other new data sets. Under the federal guidelines menu, you'll note that there is a data set on client and economic justice screening tool. I talked a little bit about that, or I talked quite a bit about that earlier, where you can quickly and easily see, areas on the map that are deemed disadvantaged. If you need to know more about the program and why you need to know that, you can pull that out pretty quickly and easily. But you can also take a look at this in specific boundaries. So I could take a look at specific counties and pull down all those census tracts within the county that are deemed disadvantaged. I can overlay this with data about specific environmental hazards. So I can see whether or not there are brownfields or Superfund sites within these areas. That's a little bit harder to see. Note that you can go in here and you can do some customization and make it a little bit larger if you want. change your icon. So lots and lots of customization can happen here. But this bright green really makes it pop, where we can see these areas that are disadvantaged that have disadvantaged community status, and really understand here, exactly why they are, by taking a look at things like brownfields. We could take a look at something like, and this data search bar is great because I can cheat a little bit and see if some of these areas, in fact, have a higher risk of lead exposure. And in fact, this is an area where it is much higher lead exposure risk. We often joke, and I guess it's not really a good joke, that there's a lot of sad data on PolicyMap, but it's really data that informs policy and helping to make changes. Really, really helpful. So we can take a look at data like lead exposure risk and brownfield, and we can even layer that. So if I'd wanted to take it a step further, and this is one of my absolute favorite customer stories, and that is, in fact, taking a look at data from, or a use case from the University of Delaware, or where Dr. Perez teaches a class on environmental injustice. And he'll take a look at information about people in poverty, and you can take a look at that by race or by ethnicity. I can look at the Black or African American population, and again, I can click through here, find those areas where there's a larger percentage of African American or Black people who are living in poverty, and I can take a look at the brownfields and Superfund sites. I can even go in, and I'll show you what we were taking a look at before when I was talking about some of the actual applications of use, and that is, we can take a look at these homeowners loan risk corporation maps and understand exactly how those policies have affected, or might still have a lasting effect here within this area. So you can overlay this data, relate it to poverty with the Holk boundaries. I can also put in data here about lead exposure risk. We were taking a look at that before. I can take a look at data related to flood risk. Or I can also take a look at social vulnerability. And this is thematic data, but I can go in and just find those areas where there's a larger socially vulnerable population. And again, if I have questions about this social vulnerability data, you can go directly to our data dictionary and get a full definition. But you can also go in and click on the I and pull up a database or a description for that data later as well. Okay, let's keep on exploring some of the unique data sets or data sets that are here within PolicyMap. What I wanted to show you as well is some of the unique data. You can take a look, and anything that has this small orange P next to it is going to be some of our unique or exclusive data. And this is data that can be layered with the demographic data. But for instance, we can find information on consumer spending habits, total spending, or spending on housing, food at home, away from home, education. Here I can see, those areas where there's a much larger dollar amount, or people are spending much more on household or on housing. Under incomes and spending, we can also find information about medical spending, the cost to the patient, and then the total payments, including insurance, data on affordability and housing unit affordability. So we can take a look at homeownership affordability and rental affordability as a percentage of the area median income. Really, really, a great, one of our unique data sets that's created internally. And then data on economic mobility. So this is a data set that is an exclusive data set as well. We can find the high income people raised in very low income families. So it's really the opportunity insights data. Again, we can find the upward mobility rate for people raised in very low-income families. And we see that the people in Center City, Philadelphia, have a much better upward mobility rate than some of those areas to the north, in North Philadelphia. Other housing data sets that are unique and that we've talked about a little bit is data on specific housing locations. The home sale data that we talked a little bit about in our beginning examples, where we can find specific zip codes and see those areas that have a very highward trend in housing costs. For zip code 12123, we can see the trend chart here and really see the complete upward trend for this very hot neighborhood within the city of Philadelphia, where in 2008 you could buy a home, or the median single family home price was $190,000. And in 2023, it's $575,000. Under housing, you'll find information about affordability and cost burdens. You'll find data on homeowners who are burdened by their mortgages and renters who are extremely burdened or cost burdened. Again, this data can be broken out or disaggregated by age or by income. So we can find here those areas where there's a larger number of seniors who are burdened by their rents. And then we can look for the helpers. So we can see whether or not there are specific stakeholders in the community. We can look at things like where are the nonprofits, also found under the quality of life menu. And this data, again, can be filtered by their tax-exempt taxonomy. So maybe I'm looking for, those nonprofits who work in housing and shelter, or maybe with a specific population, where I can pull that out and put on the labels and look at access to nonprofits within these specific neighborhoods. So you can see the application for use not only in the social sciences, but certainly within social work and nursing and public health, and being able to find access to healthcare and to helpers within specific neighborhoods. More data sets that are unique to PolicyMap and that might be of interest to you and to your different programs and their faculty members might be data related to mortgage loans. You can find information about mortgage loans and mortgage loan denials. This can be broken out by race and by ethnicity. And again, you can take a look at trends over time. We're mapping extent. We could take a look at the entire United States if we want. But here we can see, this tremendous upward trend for this particular census tract. We can also take a look at this, citywide or countywide and understand things a little bit better there. Under quality of life, there's also a good deal of data. One of the data sets that I'd wanted to bring to your attention is information about broadband availability and also data on computer and internet access by grade. You can find information about availability status. Really, really interesting to take a look at this data within rural areas, and also take a look about data on download and upload speeds and the number of providers within a specific area. You'll find information again about flood risk and social vulnerability, resilience. So all of these areas that have been identified as vulnerable and resilient during times of natural disaster. And what's really nice is, another great application that one of our professors of engineering at the University of Washington brought to our attention is that he and his student researchers will actually look at changes over time. They'll look at different, social and economic factors and health factors after times of natural disaster. So really, just another great application. I'm going to take a little bit of break, but I'm going to leave you with just like one of my absolute favorite applications or examples of use by one of our subscribers in Texas, and they were taking a look at data related to, people in poverty, or they were looking for data about mothers. So here we go. Household type. We can find family type. Family type, and we can find single female with children. And we can take a look and, we can layer this if we wanted to layer this with poverty levels. So we can go in and look at this. And we can take a look at people in poverty, age, and, change our cut points a little bit here. Find those areas. And then we can maybe take a look at where the SNAP retail locations are. And this is actually a community outreach project that this school is using, where they were trying to figure out where they can provide diapers and formula into specific SNAP retail locations that they would collect through their community service projects. So, sort of a happy, uplifting use of PolicyMap at one of our larger universities. So just a really, really interesting way to use the tool to, to make some changes or to do something really good within a community. We also have some nursing students here in the Philadelphia area from Thomas Jefferson who use this to sort of identify areas where there's a wicked problem and come up with unique solutions. If you ever have any questions or thoughts about that, certainly get in touch with me. So I wanted to check and see, it doesn't look like we have a lot of questions. But if anybody has anything that they'd like to bring up, here is my email address. It's betsy.minnich@policymap.com. We do have a tremendous amount of support materials online. In fact, we just launched a bot, and there's some support materials and a knowledge base where you can add in questions. We do offer twice weekly free training sessions to subscribers and non-subscribers alike. And, certainly we're here if you wanted to, get a personalized demonstration or talk about the data, talk about the platform. We didn't get into everything you can do with the platform, including uploading your own data onto the map, but that's certainly something that we're happy to cover with you. And also, I just wanted to summarize some of the things that we talked about. So the data from PolicyMap is coming from over 150 public and private sources across geographies in the United States. We're used for demographic analysis, for health outcomes and disparities research, for economic analysis, for finding data related to housing and transportation and the environment. And some of the use cases we talked about were things like the lasting effects of redlining, and we talked about gentrification. Lots and lots of different programs use PolicyMap. It is not just a tool for geographers, but it's a tool used in the health sciences, in social sciences, and public policy and administration, urban studies. So definitely, something that can be used. Another great use case is journalism, creating maps and charts that students can pull into their work. So, with that, that's really all I was planning on covering today, but certainly I'm here for you if you ever have any questions or if you need anything. Well, thank you so much for joining us today, everyone. I hope you learned something new and took something good away from this, and I really appreciate you joining us. Take care.